Hi, I'm Charlene from Line Therapy, Utah. Today we're going to be talking about progressions for core stability. Mainly with this exercise, we focus on working the muscle called the transverse abdominis, and it's a muscle that goes right along through here. So this is Matt. He's going to be my patient today demonstrating. So go ahead and bend your knees, Matt. So with this exercise, we use a blood pressure cuff, and I just fold the blood pressure cuff in half. This way we can visually see what the muscles are doing. So I'm going to put this underneath your low back, Matt. Go ahead and relax.
We'll see. That'll tell us really whether or not we're seeing.
So I just put the blood pressure cuff right the base of Matt's back. And then I'm going to pump up the needle on the blood pressure cuff to 40. Okay, Matt, I'm going to give that to you so he can see what his muscles are doing. So the first one, Matt, I'm going to have you tighten your core. Imagine bringing your belly button down into the blood pressure cuff, and the needle should raise up a little higher. I want it to raise to about 60 to 70. If you go too high and you're unable to breathe, you're compensating using a pelvic tilt and not the muscles I want you to. So you should still be able to breathe with these exercises. So I'm going to have him do this exercise 3 times for about 30 seconds, making sure he can get to that needle up to about 60 or 70 and hold it there. The next progression, Matt, I'm going to have you go ahead and contract the abdominals again, getting it to about 60 or 70. Good. And then you're going to perform marches, alternating each leg. The key with this one is being able to hold it at 60 or 70 and not letting the needle bounce. And this one's harder than it looks. Okay. Often I'll have someone do this about 2 to 3 sets of 10 on each side. The third progression is bring the knee up, then straightening the leg, knee back up and down, alternating both sides. Same thought process, trying to keep the needle around 60 or 70, still breathing. Good. Do a couple more on each side, Matt.
I don't want to.
Yeah, you've already been asking about enough stuff.
That's right. And then I got lost.
Good.
Oh, really?
The fourth progression we're going to have Matt do is go ahead and bring both knees up in about in a hook line, and he's going to do reverse marches. So same thing, contracting the core, bringing the needle to about 60 or 70. This one's going to be a lot harder because a lot of people are going to want to arch their back. You should really focus on keeping your core tight and bringing that belly button down into the table.
61 tablets. So that's about
Okay,
3 weeks.
ready for the fifth one?
Oh yeah.
So fifth one, same thing,
So
going back in hook line, and then you're going to straighten one leg out
I want to,
and then alternate.
Well, I understand that.
I still have to have blood.
And again, this gets harder and harder to maintain that needle up to 60 or 70 and not letting the needle
Being
bounce.
very cautious.
Yeah, that's probably best.
Okay, so performing the second to last progression, bringing both knees up, and then keeping that needle at 60 or 70, not letting that back arch. Out, and in. Good. Now we'll do this just one more time for time's sake. Good, and rest. So the last progression, he's going to straighten both of his knees out on the table, and then tighten his core, bring the needle to about 60 or 70, making sure he doesn't arch his back. He's going to raise both of his legs. Good, and back down. So most people cannot maintain this, not letting the needle bounce with the blood pressure cuff. This one's pretty difficult. Good.